Well, a warm welcome to today's update. I want to look at the UK and the United States and a few other countries that illustrate what's going on with this pandemic at the moment, because globally the numbers are still continuing to increase. So globally the cases now are over 17 million, and this is confirmed cases, of course. The real number is always higher. Deaths 668,000 confirmed deaths. Now, there's been a really important announcement in the UK about self-isolation. So, first of all, we know that if someone has been in contact with a person who is symptomatic or pre-symptomatic, in other words, if a person is likely to have been infected, they need to quarantine for 14 days because the incubation period of this illness is 2 to 14 days. Early studies showed about 95% of people that become positive will become positive within 12 days. So we say 14 days to be fairly safe. Now, very, very, very occasionally, someone might incubate COVID-19 for more than 14 days, but that will be very uncommon. So 2 to 14 days, and the typical incubation period is about 6 days. So fairly clear 2 to 14 days about that. But the medical authorities in the UK have now said that if someone is symptomatic, they need to isolate for 10 days. Now, it was 7. So this is an extra 3 days. So from day 1 is the day when someone first develops symptoms, and they should be isolated now for 10 days, not for 7 days. Now, the likelihood of someone still being infectious in the 7th, 8th, 9th and 10th day aren't very high, but they are significant. There is a risk there. So this has actually got a lot of global importance. What this means is, to be safe, that everyone around the world should be self-isolating for 10 days after they develop the first symptom on day 1. And indeed, if they're still symptomatic after 10 days, they should carry on self-isolating. So this is really quite a major change. So given that the British medical authorities are fairly clear about this now, all the senior medical officers are saying this, then I really feel that everyone around the world should be self-isolating for 10 days after the first symptoms. An extra 3 days. And what this means is that many cases of transmission may have occurred by people who were on the 8th, 9th and 10th day after their symptoms began. But it now transpires, we can look back and say, well, no, they were probably still infectious. So this is actually quite a big deal. So very important that everyone around the world now takes that on board, I believe. And it's now 10 days after the first symptoms, not 7 days after the first symptoms. So the quarantine is the same at 14 days. That's the British government site. But 10 days after symptoms begin. So 10 days now. Not 7. So self-isolation for 10 days, up from 7 days. This was actually announced by England's Deputy Chief Medical Officer, but all the other medical officers agreed. And they're saying there's a low but real possibility. In other words, this happens in the real world, of infectivity 7, 8, 9, 10 days after the onset of symptoms. So really quite a significant announcement there. We've been reporting on this disease since January, and I've been reporting on it since January, and that's the first time that has been officially declared. So quite an important announcement, 10 days from symptoms. Do post that one on Facebook and let everyone know that, because that's got great global implications. Because if that's the case in the UK, it's going to be the case everywhere. It's not as if Papua New Guinea is going to have different transmission characteristics. It's the same virus, essentially the same virus. Now, what I could only call the deaths debate. Now, this is fairly unsavoury, really, but that's the official UK death figure for all of the United Kingdom. Scotland, England, Wales, Northern Ireland. Now, the Office for National Statistics have been comparing all-cause mortality. Now, we've looked at this quite a bit. There's mortality from COVID-19 and there's mortality from all causes. In other words, the total number of people that die in a given period of time is all-cause mortality. And they've been comparing European countries and regions from January to June 2020. This is what the Office for National Statistics does. They compare numbers. They are remarkably good at it. Analysis of weeks 8 to 24. So that's the week ending the 21st of February up to the 12th of June. England had the highest level of excess mortality in Europe for the period as a whole. Now, I've actually just finished looking at this data not long ago, and areas of Spain and Italy had by far and away the highest spikes. 8 or 900%, 8 or 9 times what they normally get. But it was for a short period of time. So deaths were 8 times, 9 times normal for a few days or for a week. Whereas in the UK, the spikes were never that high, but it was sustained for longer. Now, having said that, we were looking at evidence yesterday, and I've had this more or less confirmed by quite a few Spanish viewers, that the Spanish death rates are greatly underreported, perhaps by as much as 60%. So my private hunch is that it's Spain that's actually lost this comparison, shall we say. It's not a competition. I've lost this comparison rather than the UK. But at the moment, given the official data that's available, the UK has not done too well. Now, these excess deaths, and again, we've looked at this as we've gone along, these excess deaths are partly due to COVID-19, of course, but they're also due to all of the things that have changed because of COVID-19. People not attending hospital, people not getting chemotherapy. Even admissions for heart attacks and strokes have gone down as people fail to access healthcare. That, to put it quite simply, makes the difference between life and death. So many people have died during this pandemic so far, what we might call the collateral damage. And that is still going on around the world. And indeed, when we look at collateral damage, when we look at infant mortality rates, when we look at perinatal mortality, when we look at the effects of famine and malnutrition all around the world, when we look back at this in a few years' time, it could well be that more people die as consequences of this pandemic than actually will die from the virus itself. And that's quite tragic, because it's difficult to do things about the virus. We know we can do things, but these other things are much more under human control. And it's a pity that there is this excess mortality of other conditions as well as the virus itself. Now, moving on to the United States. 4.5 million cases, well over 150,000 deaths in the United States. Now, just to illustrate some of the... I'm just going to tell you the way it is. I'm not going to worry about offending people. I'm just an outsider. I have been to the States a couple of times. I love it. I found the people fantastic. I've always had a great time there. All the Americans or the United States people I've come across, with the odd exception, have been excellent. So I have no axe to grind or anything, but it just seems to me there's some truly absurd things going on. And this is an example. Now, this Congressman Louis Gohmert, whose name I've pronounced wrong, sorry, sir. Anyway, has advocated non-mask wearing and has been a non-mask wearer himself. And he said he's been diagnosed as symptomatic. He was due to fly off to Texas. I think he's a Texas congressman. He was due to fly off to Texas on Air Force One with the president, and presumably he's self-isolating now. He doesn't say that, but I'd be very disappointed if he wasn't. In fact, it would be negligent if he wasn't. I'm sure he is. He says this: "I'm asymptomatic, but apparently I have the Wuhan virus." Well, I don't know how old he is, but I guess he's probably in his 60s, which gives maybe a 3% chance of getting severe complications. Let's hope he doesn't. Let's hope he does have a mild illness, and let's hope he makes a full recovery. But, you know, he may develop a myocarditis as a complication. He may develop pulmonary fibrosis. He may develop acute respiratory failure. He may develop shock. He may develop sepsis. He may develop all of these complications that can go with COVID-19 and can kill people. I really hope he doesn't, but he may. Let's hope he doesn't. But apparently I have the Wuhan virus. Well, I don't really see the point in being provocative like this. This is the severe acute respiratory syndrome coronavirus type 2, which causes COVID-19, coronavirus disease, first identified in 2019. But we'll leave that. Now, this bit is just... This is my incredulity here, sheer incredulity. This is a congressman, senior politician. And now, just this guy could pick up the phone, talk to the biggest university in Texas, whatever that is, and say, give me your boss epidemiologist. And he'd be on the phone in minutes because this is the congressman for the state. And he could say, Louis Gohmert could say to this congressman, what's the deal on wearing masks, mate? Tell me about it. And he would be given all the details on this from the very best brains in the state who would talk to him. He has access to all this expertise. And yet this is what he came out with. And I actually wrote this down word for word from CNN News Report. And this is what he said. This is the congressman said this. I can't help but wonder if by keeping a mask on and keeping it in place, if I might have put some germs, some of the virus, onto the mask and breathed it in. This guy is actually saying, I think, correct me if I'm wrong, sir, correct me if I'm wrong, by all means. But it appears he's saying to me that the mask actually probably caused this infection. This is just unbelievable when he has access to the best brains in the world and yet comes out with, let's say, a statement which is of questionable scientific validity. Shall we leave it at that? Just the incredulity is just incredible. Now, he wasn't wearing a mask the day before diagnosis, so he was diagnosed, I think it was yesterday, and he was not wearing a mask the day before. And of course, for the couple of days before you start with symptoms, you are infectious. So when he was refusing to wear a mask, unbeknown to him, he was in the pre-symptomatic stage, he would be infectious and may well have infected other people because of his dogma not to wear a mask. Other people could die as a result of that. That is not impossible. So quite incredible. Now, I believe this guy is a lawyer. Fine. But, I've said many times, I wish we had more doctors, nurses, engineers, scientists amongst our political leaders. Now, having said that, I've no idea what the divide is in the United States. I know in the UK we've got, I was going to say far too many, but we've actually got quite a lot of people that have got a background in law in our parliament compared to, say, those that have a background in nursing or medicine or science. To me, that's a problem. But anyway, so Nancy Pelosi has now said she's mandating masks on the House floor, which I'm pleased to hear. Pleased to hear that. Don't support Nancy in everything. Don't support Lewis in everything. But I'm glad to hear that she's mandating masks on the floor. So Ms. Pelosi, well done on that particular point. Now, this famous retweet that the president has retweeted. And again, this is a direct quote. So you've got the president saying one thing and you've got Dr. Fauci saying this about his retweet. And again, it was just so incredible. I've actually transcribed what he said from the news report. This, of course, is about these people, or I think a lot of them were doctors. I'm going to check it. But, saying that hydroxychloroquine is a great drug. Now the recovery trial in the UK dropped hydroxychloroquine as being non-efficacious and toxic. Now, I must say, to be fair, I do kind of worry about the toxic thing because I've been using hydroxychloroquine on and off. Well, I first used it back in the 1980s for malaria prophylaxis and for treating malaria. So if given in the right dose, we've had it for years and years. So it is a bit strange. But anyway, just what Dr. Fauci said regarding the president's retreat, regarding these doctors who were saying that hydroxychloroquine is great. This is what Dr. Fauci said. When you have a bunch of people spouting something that isn't true. That isn't true. It's exactly what he said. The only recourse you have is to be very, very clear in presenting the scientific data that essentially contradicts that. So he's saying they're wrong. So there, I think Dr. Fauci is saying hydroxychloroquine does not work. Dr. Fauci, if I've got you wrong, contact me and I'll correct it in the very next video, I promise. But that seems to be what he's saying. So scientific data on hydroxychloroquine. So I think what I'm going to have to do is actually break that down and do a separate video on that. Because the scientific data does appear to be there now, and I'm going to work out exactly what it's saying. But anyway, we did report on the recovery trial at the time and why the hydroxychloroquine was dropped from the recovery trial. But you have this situation between the president and other doctors and the leading doctor, and it just seems bizarre. Why cannot they analyse the science and come up with a definitive conclusion? Anyway, that's what I plan to do as soon as I get time. I'm going to analyse the science and come up with I was going to say a definitive conclusion. That would be too complacent of me. Come up with my view analysing the material. Now, the Centre for Disease Control, weekending the 18th of July, always a bit behind, of course. Overall weekly hospitalisations are increasing for the past 3 consecutive weeks, and we know that's still increasing, so we can now say overall hospital admissions have increased over the past 4 weeks in the United States. Concerning. Now, this next thing was... I've kind of known this before, but it just takes you aback when you look at the data of this nature. American Indians, non-Hispanics, American indigenous Americans, who've been there for... Actually, it's a good question, that. How long have they been there for? The traditional view is about 15 or 16,000 years, but there's some new data that said it might be 30,000 years. So anyway, they've been there for longer than any European types have. So American Indians, indigenous Americans, or Alaskan natives, indigenous people from Alaska, have an age-adjusted hospitalisation rate. So it's not to do with the age. That's taken into account. 5.3 times higher than whites. So that means you get 5.3 indigenous Americans in for every one European white person that comes in. That is really quite... Yeah, it's very concerning. African Americans, black people, it's times 4.7. Hispanics and Latinos, it's 4.6. Now, I have no data on the vitamin D status of native indigenous Americans. But we do know that more African Americans are vitamin D deficient than white Americans. We do know that more Hispanics and Latinos are vitamin D deficient than white Americans. To me, it's an obvious variable to correct. And after all this time of talking about it, I first broadcast about vitamin D in January, believe it or not. And it hasn't changed anything. No. Anyway. Yes, it's kind of disappointing when you realise maybe a few individuals, but in terms of changing policy or people that have power, considering the scientific argument that I have repeated time and time and time again in different formats. The most recent time was just 2 or 3 days ago. The science is, in my view, conclusive, and yet people, in my view, are immunocompromised through simple lack of vitamin D, and it's still an ongoing pandemic. Now, carrying on with the United States, the red zones are now described as 100 new cases per 100,000 per week increase. 100 new cases per 100,000 people. And the red states, or the red zones, are now described as all these states. I've just listed them out there, going around the country kind of anti-clockwise. So they are all the red states, there. California, Florida, Texas, we know are particularly badly affected, and large population states. So they are all red zone states with increasing cases. And it looks like they're all going to carry on increasing. I'll tell you why I'm saying it in a minute. Dr. Fauci said also troubling signs in Ohio, Kentucky, Ohio, Indiana, Kentucky, Tennessee. So over the next few days, I would expect these states, I would predict that these states will be joining that list of 21 and turning that into a list of 25 red zone states. I am afraid. And this is what Dr. Fauci said. He's seeing it says going to be a surge in 2 or 3 weeks' time. Surge in cases in 2 or 3 weeks' time. So we have not yet reached anything like the peak in the United States. For example, now California is the worst state. I think California is the second at the moment. Record increase in COVID-19 deaths for the third day in a row in Florida. In fact, I think it's 4 days now. Getting on for 500,000 cases, nearly 7,000 deaths in Florida alone. Now, the University of Florida refuses to confirm this story. So it may or may not be true. Although it's reported in about 6 different news outlets that I browsed around and in many more. So apparently there's a cluster of COVID-19 infections in 19 young people. 17 of these, I believe, we don't know because they won't confirm it, are in the anesthesiology department. Now in England that's what we call anaesthetics. These are people doing so as far as I know these are residents. I believe that's like it's like a training program. We have an equivalent in the UK. They're basically learning to be anaesthetists or doing an anaesthetic rotation. And 17 of them, plus I think someone who was a fellow, so I guess that's a more senior doctor, and some administrator. They basically went to a, what's the polite way to put it? A party. Apparently there's 20 to 30 other people there, and they picked up the infection. Going to a party. We believe it was indoor. We believe there was music. We believe there was loud talking, and we believe there was a certain amount of drinking. I mean, this is as incredible as the Congressman. If this is what the doctors are doing, a group of doctors are doing. I mean, of course, most of the doctors in America are wonderful and disciplined, but it just takes a few to really cloud things up and set bad examples. I'm delighted that they all seem to be recovering at home. Let's hope that carries on being the case. It's not clear whether the residents and the fellow worked while infected. It's not clear because, of course, won't confirm. Did they work when they were infected? I don't know. Don't think anyone does. I don't anyway. This is what I would call a super spreader event. And of course, each of those could go on and potentially infect many others. But they're now recovering at home, hopefully isolating. We have a need for personal responsibility. And politicians and healthcare professionals only have the right to say, do as I do. They never have the right to say, do as I say. It can only be ever do as I do. And that's just a couple of examples of where that's failed. Now, the Hajj, Saudi Arabia, of course, 2.5 million attendees last year. This year it's between 1,000 and 10,000 attendees. So quite a major change to the Islamic year. And glad to see that responsibility is being practiced by the Saudi authorities. India's been a concern since the start, as you know. Record number of cases. This is the first 24-hour period. It's been over 50,000 new cases in India. It's just so reminiscent of seeing it go past the 50,000 milestone in the United States. 1.5 million official cases. The real number's higher, way higher, way higher. We've looked at serological evidence for that in the past. Deaths are also higher, but that's the official figure. Now, infections in rural areas where healthcare systems there will be struggling to cope. Now, I've done some work in rural parts of India, not a lot, but a bit, and the healthcare systems there basically aren't adequate or can't be afforded by many of the local people at the best of times, especially in some poorer areas. Huge swathes of the Indian population do not get the healthcare I would like to see, and any other fair-minded person would like to see. Especially girls have very limited access to healthcare in many rural areas. Women also can have very limited access to healthcare in many areas. But it's not a lot better for men and boys, although, anyways, it's not a lot better. So given the economic development in India, the lack of rural healthcare is a national indictment. But it is the case. So there's been many increasing cases in Delhi, Mumbai were epicenters. Now it's spreading to many rural areas, increasing cases, and the health systems there will not be able to cope, and that will increase case fatality rate. Now, Russia, increasing cases, increasing deaths. The death criteria for a death to be counted as COVID-19 in Russia requires quite a high burden of proof. So we know the real numbers are way higher, and we know that the World Health Organization and the European Union question the data. Afghanistan, again, these numbers are just ridiculous. Serological studies in Afghanistan are way higher than this. Serological studies in Kabul, rather, just for Kabul. But at the moment, people are crowding into markets, ignoring distancing orders, rarely wearing masks, preparing for Eid. So, whereas the Saudi authorities have taken control and have controlled the Hajj, it looks like Afghanistan is a bit of a free-for-all. Meaning that there'll be a great increase in the spread of cases. And it'll just be one other to add on to the list of religious events which have caused spread of disease. And the Eid festivities in Afghanistan will be one more of those. And there's no doubt in my mind that people will die as a result of this. Philippines, again, record numbers of cases in the Philippines. We did talk about that recently. I think many rural areas will be spared until there's a vaccine. Other areas, metropolitan Manila, for example, could be devastated. Sweden, the government the health authorities renewed their encouragement to people to work from home when possible to reduce crowding in public transport. And it seems like the authorities in Sweden are worried about a second wave. We talked about this on the German TV program a couple of days ago. You might have seen that. If our contacts go up again, there is a considerable risk of a new spread during the autumn. So yeah, I'm worried about this. Not so much the autumn, but the early part of winter. But we see the Swedish authorities are worried. But if you'd like to climb Mount Everest and you've got a huge amount of money, and or other Himalayan peaks for that matter, you'll be pleased to hear that the Nepali authorities are now allowing that again. So, increasing cases in many parts of the world, and the United States are going to carry on increasing. Now, if you didn't see the video with DWTV, do check it out, because what I said there was, from everything we've looked at, it looks like, well, there's an increase in cases in Spain, Italy, Germany. We know that. Robert Koch Institute in Germany is concerned. But I'm fairly optimistic that the Germans can get this under control. And I think the Italians and the French can potentially get this under control. Spanish is a bit more concerning. There's a great increase in cases in Spain at the moment, but it's fairly regionalised in Spain. So Aragon, for example, is badly affected. Catalonia, I think, was badly affected. But it's not all of Spain. So I'm fairly optimistic the Spanish can compartmentalise that. So hopefully, for most of Europe, I'm hopeful that the cases can stay fairly flat for the rest of the summer and into autumn. What I'm more concerned about is increasing cases that could well come about in early winter and later winter. That's when I'm more concerned about. In terms of the United States, Dr. Fauci is concerned there's going to be a great increase in the next 2 or 3 weeks. And I suspect he's right. I think the situation in the United States is going to be much harder to control. Let me put it another way. I don't think it's going to be effectively controlled the way things are going. So the United States, immediate concern. India, places like that. India, fairly immediate concern. Philippines, Indonesia, again, perhaps later in the year would be a greater concern. But next winter is the time of most anxiety for me. And a vaccine will probably not be with us until months into 2021.